Ah, the tantalizing allure of relief from the clutches of arthritis, a condition that seems to have a personal vendetta against our joints, leaving us to ponder the meaning of life as we wince with every movement. Fear not, for modern medicine has a few tricks up its lab-coated sleeve to combat this villainous ailment. So sit back, relax, and prepare to embark on a pharmaceutical adventure as we unveil the top 10 drugs for arthritis in the US. Disclaimer: the information provided in this video is for educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Methotrexate. Methotrexate, the wise old sage of arthritis medications. The anti-inflammatory drug has been around for over 3 decades, earning it the prestigious title of veteran in the world of rheumatoid arthritis treatment. And boy, does it know how to make an entrance. Methotrexate is like a secret agent infiltrating the ranks of your immune system. It boldly suppresses the immune response, showing those pesky inflammation-causing cells who's boss. It's like the superhero that swoops in, cape bellowing behind, ready to save the day by calming down the fiery joints and reducing swelling. NSAIDs. NSAIDs, or non-steroidal anti-inflammatory drugs, are a type of pain reliever that reduces inflammation. They are commonly used to treat arthritis as well as other conditions such as headaches, menstrual cramps, and muscle aches. Some of the most popular NSAIDs include ibuprofen, naproxen, and aspirin. Biologics. Biologics are a newer class of drugs that target specific proteins in the immune system. They are often used to treat moderate to severe rheumatoid arthritis and other autoimmune disease. Biologics are usually injected or infused, and they can have significant side effects. Some of the most commonly prescribed biologics for arthritis include Humira, Enbrel, and Remicade. Corticosteroids. Ah, yes, corticosteroids. The steroids that don't make you bulky, but can still make a big impact on arthritis. These bad boys are like the superhero of arthritis medication, swooping in to save the day by reducing inflammation and swelling. In fact, corticosteroids are so versatile that they're used to treat all sorts of conditions from asthma to allergies to arthritis. They're like the Swiss Army knife of medication, but without the annoying little scissors that always break. DMARDs. DMARDs, or disease-modifying anti-rheumatic drugs, are a type of medication that can slow down or stop the progression of rheumatic arthritis. They work by suppressing the immune system and reducing inflammation. Now, DMARDs come in different forms, just like the spices in your kitchen cabinet. You can take them orally, like the daily pill that you might confuse with your multivitamin, or go for the more adventurous route of injections. Yes, it's like playing doctor with yourself. But fear not, for the needle is your ally in this battle against arthritis. These DMARDs, with their peculiar names, sound like characters from My Secret Society: methotrexate, sulfasalazine, and leflunomide. No, they're not the latest trendy names for exotic pets. They're the heavyweights in the world of arthritis treatment. They're like the Avengers, but with more paperwork and less spandex. These formidable drugs work their magic by putting the breakers on your immune system's overzealous attacks and curbing the inflammation that wreaks havoc on your joints. COX-2 inhibitors. You see, when it comes to arthritis, it's like there's a tiny party happening inside your bodies, and the COX-2 enzymes is the ultimate troublemaker. It's the guy who shows up uninvited, starts a riot, and leaves everyone in pain and discomfort. But fear not, for COX-2 inhibitors arrive just in time, ready to kick these rogue enzymes out of the party. So how do you take these incredible COX-2 inhibitors? Well, they come in the form of a good all-oral medication. You just pop that pill and let it work its magic from the inside out. It's like a tiny superhero squad heading straight to the battlefield of your joints, armed with the power to vanquish inflammation and pain. JAK inhibitors. JAK inhibitors are a newer class of drugs that target the Janus kinase or JAK enzymes, which play a key role in the immune system. They are often used to treat rheumatoid arthritis and other autoimmune diseases. JAK inhibitors can be taken orally, and some of the most commonly prescribed drugs in the category include Xeljanz, Olumiant, and Revoc. TNF inhibitors. TNF inhibitors are a typical biologic drug that specifically target the tumor necrosis factor protein, which is responsible for inflammation and joint damage and rheumatoid arthritis. They're often used to treat moderate to severe arthritis, and they can be injected or infused. Some of the most popular TNF inhibitors including Humira, Enbrel, and Remicade. Janus kinase inhibitors. Janus kinase inhibitors, the new kids on the arthritis medication block. These bad boys target those pesky JAK enzymes, which play a key role in the body's inflammatory response. By taking aim at these enzymes, JAK inhibitors help to quiet down the inflammation and ease the symptoms of rheumatoid arthritis. And they're not just any old drugs. Mind you, we're talking about Xeljanz, Olumiant, and Revoc, the cool kids of the JAK inhibitor crew. Opioids. The infamous opioids. These little pain-relieving troublemakers are like the wild cards of arthritis treatment. While they aren't typically the go-to option, they do have their place for those moments when pain feels like an unwelcome guest who has overstayed their welcome. But hold on your hats, folks! Opioids come with a side of caution. They have this uncanny ability to befriend addiction, like a clingy companion who just won't take a hint. So they should be treated with utmost care and under the watchful eye of a medical professional. Not only can opioids become addictive faster than you can say abracadabra, but they also bring a bunch of side effects to the party. They might make you feel drowsy, nauseous, and even a little loopy, like you just stumbled into a psychedelic circus. These medications for arthritis have diverse functions that range from alleviating pain and reducing inflammation to influencing the progression of the disease itself. While they are important tools in managing arthritis, it is crucial to understand that medication alone is not the sole solution. It is just one piece of the puzzle. Arthritis management involves a holistic approach that extends beyond relying solely on medication. Lifestyle changes such as maintaining a healthy diet, regular exercise, and weight management are vital components. These lifestyle adjustments can help reduce stress on the joints, improve flexibility and strength, and contribute to overall well-being. And if you're new here, hello and welcome to Medication Updates Quick Facts. Our channel's focus on health and wellness topics is driven by the increasing awareness and importance of maintaining good health in our fast-paced and often stressful lives. If this is something you're into, consider hitting the subscribe button and ring the bell icon so you can be updated on our next upload. Thanks for watching.